And this week, we will take a 1 hour galactic journey, zooming past through the Milky Way, gazing with wonder at the menstruation constellation. Puberty can be a challenging time for any young person. For children and young people with intellectual disability or autism, those changes can feel even more intense and confusing. And that can make it a tough journey for parents and carers too. Throughout this webinar series, we aim to be navigating puberty, make it a less bumpy ride by sharing practical strategies and insight gathered from conversation with parents and carers. And we hope to help you feel more confident in supporting your young person through this stage of life. Just for your information, we are recording the webinar today, and the link will be emailed to you with all of the recordings at the end of the webinar series in April. My name is Angelica. I'm relatively new to family planning, but have been helping young people understand and navigate their period for over a decade now. And I'm quite passionate about helping people find their preferred method to manage their periods for the optimal lifestyle. Also presenting with me today, two of my colleagues, and I'll invite them to introduce themselves, Emily and Dr. Soraya Cooper. Over to you, Emily.
Good afternoon, everyone. Thanks so much for joining us today. As Anne said, my name is Emily, and you may recognise me from our two earlier webinars this month. A little bit about me. I'm originally from New Zealand, and I've taught across the world, and I've often taught young people around puberty and periods. And I've really seen how specifically knowledge around periods can be so exciting and important and empowering for young people. So I'm really excited to spend this next hour with you. Over to you, Dr. Soraya.
Hey everyone, my name is Dr. Soraya. I'm a GP and I work at Family Planning, and a big part of my work is supporting young people and families with puberty and periods and sexual health, reproductive health. So I'm really excited to be here today. One of the most important things to remember going into this talk is that periods are normal and they are a healthy part of growing up. For lots of young people, it might seem quite scary or confusing. People might be a bit worried if they're not sure what's happening. So I think it's great that you've all shown up today. You've taken the time out to learn a bit about your bodies and learn about puberty and periods. So I do think it's a really important thing to have these open conversations. And if you do have questions about puberty and what's going on in your body, to seek advice from appropriate health professionals. So yeah, I'm really glad. Let's get stuck into it.
Thank you, Dr. Soraya. Before we begin today's session, I'd like to acknowledge the traditional custodian of country and the ongoing connection of Aboriginal and Torres Strait Islander people to land, culture, and community. We recognize the long history of First Nation people in guiding their own sexual and reproductive health through cultural knowledge and practices. We pay our respects to elders past and present and commit to listening, learning, and working in partnership to support health, rights, and access for all. I pay my personal respects to the Wangal people, the owners of the land I am currently on today, and I say that their sovereignty was never ceded. For many young people with intellectual disability or autism, navigating puberty can feel confusing, overwhelming, or even a bit scary. And some parents or carers, it often feels like big questions that need to be raised on how to prepare, what to expect, and how to talk about these changes with confidence. So today we'll talk about how to prepare your child for their first period, what to expect from a first period, the different period products that are available, and there are so many products that are available nowadays. Can't wait for you to hear about them. A step-by-step guide on how to use a pad, understanding and supporting your young person to manage period pain, contraception and ways to manage periods, helpful resources for you and your child. We'll also be sharing some fantastic Planet Puberty resources that you can use today, so you won't be flying solo. So before we get started, I want to acknowledge that you are the expert when it comes to your child, and you know and understand how they learn, how they communicate and respond best. So our goal today is to share some strategies and ideas that you might find helpful along the way. One of the most important things you can do to support your child through puberty is to start the conversation early and to keep it going. So we like to call this approach talk soon and talk often. Puberty is a natural part of growing up, and children benefit from learning about changes that will happen to their body before those changes start to happen. That way, when things like breast development and voice change or period starts to happen, they're not surprising or scary. They're expected and understood. One of my favorite parts of our website is the conversation starter ideas that are listed for each topic. So some examples are shown at the bottom of the slide. We encourage you to introduce periods as just one of the many signs that your child is growing into an adult, to keep it neutral, positive, age appropriate. So some of the things that you might want to say is, as you are growing older, your body will change in lots of ways. Your voice might change, you'll grow taller, people with a uterus will start to get periods. And these are all signs that your body is growing up, just like it's supposed to. Having a regular, small conversation helps build trust and make it easier for your child to come to you with questions later on. One helpful strategy for starting these conversations is the aging photo activity, where you might have a photo of your child as a baby and a photo now, and you can look at the photos together and starting from when your child was a baby up and through now, and talking about how each of those photos look different and how much the child has already grown and changed. Then you can gently introduce the idea that more changes are coming as they grow into a teenager and an adult. So an example could be, just like your feet got bigger and your hair grew longer, there'll be other changes too in your body as you keep growing. Do you want to hear about them? And this activity is familiar, personal, non-threatening, and this helps your child connect with the idea of change with something that they are already understanding, and that is growing up. Remember, you don't need to have all of the answers. Just being open, curious, and willing to talk is the most important part. When it comes to talking with your child about period, the most effective approach is to keep it simple, clear, and calm. So here are some of the messages you can start with. So a period is when blood comes out of your vagina. It happens about once a month. This gives your child the basic definition in plain, accurate language. The blood can come out for 3 to 7 days and might. This will help them understand how long a period is and something that's helpful for planning and reducing worry. This is a normal part of growing up. It doesn't mean you're sick. You're not injured in any way. This is a message that helps reduce fear or confusion, especially if your child associates blood with an injury or an illness. You might need to wear something in your underpants or wear a special underpants to stop the blood from getting onto your clothes. This introduces period products in a way that's practical and non-intimidating. If blood gets on your clothes or if your tummy hurts, you can tell an adult that it's okay to ask for help and that your child is not expected to manage everything on their own. Some of the key takeaway here is to teach 1 or 2 pieces of information at a time. Let your child absorb these basic concepts before introducing more detail. For example, in one conversation, you might just explain what a period is and when it usually happens. And then later on, you can talk about period products or what to do if cramps happen. As your child becomes more confident and curious, you can build on their knowledge with more detail over time. Remember, talking about periods does not need to be a big one-time event. It's much more helpful when it's a series of small, everyday conversations. That gives them time to think over and mull over what has been discussed. Our website has some great strategies for how to break this topic into smaller chunks and capitalize on teachable moments. One of my favorite parts of the Planet Puberty website are the videos that we have, where parents, carers, and people with disability talk about their experience of having periods. While everyone's experiences is unique, it's great to hear from others about strategies that has worked for them. We have these videos available to watch on our website. But when supporting your child through puberty, especially around periods, there are simple but powerful things that you can do to help them feel confident, prepared, and supported. Some of these things include using period positive language. First, be mindful of the language that you use. Periods are normal. They're a healthy part of growing up. So let's talk about them that way, avoiding words that make periods seem dirty or shameful or something to be embarrassed about. So instead of saying things like, your period means that your body is growing up and working as it should, or everyone gets their period. Experiences are a little different, but that's okay. Some families even choose to celebrate their child's first period as a small gesture, like having their favorite dinner or a handwritten note or a new book that can make it a special event and a positive event rather than awkward or scary. Utilizing teachable moments. So looking for everyday opportunities to bring up the topic naturally. So this could be while shopping for toiletries or seeing a period product ad on TV, or when someone in the household mentioned needing a pad or tampons. These moments give you a chance to have a short, pressure-free conversation that builds understanding over time. So you might say something like, oh, we're picking up some pads today. Do you want to see what kind we're getting and learn what they're for? And these gentle introductions create familiarity, which helps reduce anxiety and uncertainty. Being prepared. So building a period kit is one of the best ways to support your child to help them feel ready. You can do this by putting together a period kit, a small pouch that they can keep in their school bags or locker or at home. And in the kit, you might want to include a couple pair of pads or period undies, a spare pair of underwear, a Ziploc bag for soiled clothes, some wipes, and a little note from you or a small comforting item. This not only prepares them practically, but also sends a strong message. You've got this. I've got your back. I'm here to support you. And I think we'll be coming over to Dr. Soraya's talk. So I'll invite Dr. Soraya. We have the privilege of having the wonderful Dr. Soraya Cooper. Dr. Soraya specializes in preventative health, women's health, and LGBTQIA+ health, sexual health, and pediatrics. She's committed to supporting young people and their family to navigate puberty, safety, and healthy development with confidence. She's a passionate educator and has previously served as a registrar medical educator at the Royal Australian College of General Practitioners and a medical school tutor at the University of Notre Dame. She is currently a clinical instructor here at Family Planning in New South Wales. Over to you, Dr. Soraya.
Thank you so much. That was a lovely introduction. So from this slide, we can see that the medical name for the first period is called menarche, and periods begin because of a series of really quite complex hormonal signals between your brain and your ovaries, and doctors sometimes call that the hypothalamic pituitary ovarian axis. It's a bit of a mouthful, but basically that's just the communication system that regulates your period. So the average age of the first period is around 12 to 13 years, but there's a huge range of what's normal. So some young people might start a bit earlier, around 9 or 10, while others might not start until around 14 or 15. Before periods begin, the body does go through a few other changes first. So often the first sign of puberty is breast development, or what we call breast budding. And after that, you might notice beginning to grow some hair under your armpits and over your vulva. And you might also notice some changes to your skin, such as acne and a growth spurt. Lastly, you'll experience the onset of a menstrual period, and periods can be light, they can be heavy, they can sometimes skip months in between cycles in the first 1 or 2 years after starting, and this can all be within normal as well, but we'll be discussing it in more detail later on. Next slide, please. So this crazy slide shows how the menstrual cycle works over the course of the month, and it refers to the hormones that are at play in your body. So it's actually pretty cool to see this in action. So deep in the brain is a small gland. It's called the pituitary gland, and it releases hormones that provide the signal to the ovaries to start developing eggs. So at the start, you can see in the pink and purple, that's the LH, the FSH. This kickstarts the growth of small fluid-filled sacs, which are called follicles in your ovaries, and it's a bit of a race. Eventually, one follicle becomes the dominant follicle, and that releases the egg. So after there's a big surge, that big pink surge you can see of your LH hormone. So that's what we mean when we talk about the process called ovulation. Um, Separate to that, the lining of the uterus, which is called the endometrium, in the second half of your cycle will slowly thicken to support a pregnancy if needed. But if the egg isn't fertilized, that's when the lining will shed. So a period is essentially the body resetting that cycle every month, and it's the shedding of that lining. I should also say you'll hear us refer to days of your cycle. And what does that mean? So the first day of your cycle is the first day of your period. And then we kind of keep track from then. And so you might refer to someone having a 30-day cycle or a 21-day cycle. It's basically the time between the first day of your period and then the first day of your next period. Next slide. So this is a slide about what to expect. So like we've been saying, it's really helpful for young people to know what a normal period looks like before it happens. So you can be prepared, basically. So like we've mentioned many times already, periods are a healthy part of growing up, and everyone with a uterus and ovaries can expect to have a period. Most periods will last between 3 and 7 days, and during that time, someone might use around 3 to 6 pads or tampons a day, although this can vary between individuals. And the blood can also look different person to person. It might be quite bright red at the start, towards the end of the period might be darker brown, so it can change color throughout, and that's normal. Some people will also experience kind of physical symptoms during your period. So most often it can be things like cramps or bloating. But there are some hormonal changes that occur that might result in noticing some bowel changes like diarrhea during a period. So like I mentioned again, when your period first starts, they're often irregular. Cycles can vary widely in the first few years, so coming earlier or later than we expect. Because of that complex hormone signaling pathway, which I showed you earlier, it's still maturing. Next slide, thank you.
So now that we know a bit more about what's happening with a period cycle, we're going to look at some of the different options for managing that. So I've got some different pictures on the screen that I'll talk about, and then I'll hold a couple different options up as well for you to see. What's really exciting is, particularly in the kind of last few years, we've seen a lot more period products coming on the market, and that means that young people have a lot more choice around what works best for them, for their bodies, for their interests, and for their sensory needs. So at the top of the screen, we've got a tampon. Tampons come in different sizes, and typically when young people begin menstruating, they'll start with the slim or smaller size, and then as the flow may get heavier, they may progress to larger tampons, but they generally start with the smallest size. In the middle of the page there, we've got a pad, which is often a really popular starting product for young people. There are also different types of pads as well. So you can have ones with wings, which come out at the side, and they make it a bit easier to keep them in place and attached to underwear. You can have ones without wings, overnight ones, which are a bit thicker and longer and are good with heavier flows. You can also have panty liners, which can be really good options for earlier or at the end of a period when it's very light. And panty liners can also be a really good option for getting people used to the sensation. So potentially before someone started menstruating, they might want to start occasionally practicing putting a panty liner in their underwear and seeing how that feels for them. We've also got beneath the pad, which is in the middle, beneath that we've got overnight briefs, which are disposable period underwear. And then the other three options on the screen are reusable products. So at the top on the right, we have a menstrual cup. Menstrual cups are often made of silicone. They're inserted. They can sometimes last up to 12 hours, and they are reusable as long as they're sanitized every month. So after each use, they need to be washed, and then once a month they need to be sanitized, and then that same product can be used again. A bit like a tampon, this product is inserted, so it can be important to work with your young person or potentially with a medical professional as well to find the right size, because that will impact their comfort. Similar to cups, we also have menstrual discs, which are also inserted into the body. The difference between the two, there are a few differences. It's mainly around like the suction and the experience. So again, that can be a good one to talk with your young person and potentially trial some different options with. At the base, on the left, we have reusable pads, and at the base on the right, we have reusable, period underwear. For period underwear, there are also some providers that specialize in more accessible ones. So I'm holding up now, and I know I'm probably a bit small on the corner of your screen, but I'm holding up a pair that is available from Modibodi. And what's great about these is they've got Velcro at the front, so they are more accessible for young people that might have different mobility. So they're a really fantastic option. And something else that I've got available with me is also period swimwear. So this swimwear looks just like regular swimwear, but it's got a different lining, which will absorb the young person's period. And ensures that a young person can keep doing the things that they're interested in and bring them joy throughout their period. So as I said, it can take a little bit of time to find the right product, and that is different for every person. So, for some young people, if they feel a bit worried when they see blood, potentially things like period underwear that's black can be really good for them because they won't see the blood. Whereas for some people, they really want to know what's going on each day of their cycle, and they might want a pad or something that they can see how much they're menstruating each day. So it's just a really great one to involve your young person in this decision. One thing I also wanted to highlight is that a lot of period products can be accessed through NDIS as part of consumables for continence. And many brands like Modibodi and EcoPeriod allow self-managed or plan-managed participants to buy products and claim them back, often requiring an invoice from your plan managers. So you can seek a little bit more information about that on their different sites. As I mentioned, when it comes to managing periods, most young people start off with a pad as their first option. There are a couple reasons for this. They're easy to use, they're non-invasive because they're external, and they're a little bit more familiar to quite a few young people. But like all new things, it can take a bit of time to get used to. So I'm just going to go through a few strategies that can help your young person to feel more confident and independent with pads. So the first one is modeling. So letting your child see you or a trusted adult using a pad, and explaining those different steps of how the sticky side would go on the underwear. And this normalizes the process and makes it less mysterious for them. Another strategy that can be great is practicing with dolls. So you can role play with a doll or a stuffed toy to demonstrate how to place a pad on the underwear, which can make it feel more accessible and less intimidating. I've also heard of some examples where to start thinking about the menstrual cycle, the parent might put a little pad in and then occasionally put in like a little dot of blood and start practicing with the young person, like, oh, well, let's track the cycle, or let's practice setting an alarm and changing it throughout the day. As I mentioned before, wearing panty liners or becoming familiar with the products and some of the sensory kind of experiences associated can be really helpful for supporting a young person when they're experiencing the change of their first period already. We also have available on our website some really fantastic social stories and visual schedules, and I'll show these on the next slide, and we've got another example on this slide here as well. Social stories and visual schedules are especially helpful for neurodiverse children because they visually map out each step involved, from noticing it's time to change to removing and how to dispose of the pads properly. As I said, we have these resources available on our site, but that's also something that you could be talking with your OT or your team around, making that more specific to your environment as well, if there are things around like disposal and things that help your young person to be successful. Another thing that can be supportive for young people is a running commentary. So if your child needs assistance, talking them through what you're doing as you help them, and that builds their understanding of each step and prepares them to take on the tasks themselves later. Last week, we also spoke around how when you're doing this, you might provide a running commentary and have them do the last step, and then gradually provide a running commentary and have them do the last 2 steps and build that independence with a gradual release of the process. A final support that can be really helpful is phone reminders. So changing period products is really important for hygiene and health, and setting a phone or device reminder every 4 hours helps that young person to remember that they need to change that pad. That can be especially important at school or when they're doing something that might be a bit distracting for them. Something else that's a really important message that we've touched on in some of our other webinars is around privacy and reminding your young child that changing a pad is a private behaviour, so it would happen in a private place. And that could be a really cool opportunity to connect with some of our other resources around public and private, and just do a reminder of a lot of those principles. You can remind them with things like, it's something we do in the bathroom with the door closed, just like going to the toilet. If your child doesn't like pads, that's completely okay. Some children don't like the feeling, they don't like the sound or the bulkiness associated. And if that's the case, another good external option can be the period underwear instead. Period underwear is becoming more and more accessible at a range of different sites. I've heard of parents getting them at Kmart. I know I've seen them at the supermarket, most different supermarkets now. So they're easier to access. And again, there are different types and fabrics, so it can still be great to include your young person both in a sensory way and in a colour way. For example, it might make them a lot more excited if they can get a special colourful pair. And just like we talked about, maybe trialing a period liner, it can be helpful to start practicing wearing period underwear in advance so the young person's used to that sensation. Great. I'm now just going to mention some really fantastic resources that can support your young person around using a pad and just understanding some of these different products that are available and how they work. So at the top on the right, you'll see we have a social story around how to change a pad. One of my favorite things in there is the reminders of the watch and the timing, and just really that detailed step by step. We also have a more detailed social story in the middle that's available for free on our website on our resources section. And that's a longer, more extended version that goes through every part with photos as well. So they're all appropriate for a young person, but if your young person needs more concrete images and not the pictures, then that is a good option for your young person. Then we have a book called Puberty and Special Girls. We've mentioned that a couple other webinars. It's a really great resource that is aimed at young people and their carers, parents, around breaking down all parts of puberty in a way that's accessible and clear. At the base, we've got Social Narrative Putting on a Pad, Periods, a Practical Guide, and What's Happening to Ellie. This is another really fantastic book about body changes, and it shows a good example of the aging activity that Ange spoke about. I want to highlight another really fantastic resource that we don't have on the screen, that many families I've spoken with have found incredibly helpful. And that's the Autism Friendly Guide to Periods by Robin Stewart, who is an autistic author and educator. The book's a detailed and practical guide designed for young people aged 9 to 16, and it covers all the basics of menstruation, from what is a period to what products they can use to managing pain, and also knowing when to ask for help, which is something that Dr. Soraya will be talking about shortly as well. And I think my favorite part of this book is actually the way it was created. So, as I mentioned before, it was written by an autistic author. It's based on feedback from a number of young people. It also has input from medical professionals. And in its ethos, it's designed to be clear, honest, and non-scary. So it's a really great example of co-design and exploring and delivering ideas in a way that is accessible and clear and targeted for young people. We've also got different social stories on our website. Again, all of our resources are free. So on our website, in the top section, we have resources, and then within those, you can search for periods, for tampons, for pads. A lot of our visual schedules and social stories are saved under PDF. So the one on the screen at the moment is a tampon visual story schedule. It uses clear and simple images and clear language to explain each step of using a tampon. It also covers really important hygiene practices like washing hands before and after, and reinforces how changing a tampon is a private activity. We recommend that you could print out the schedule or have it accessible on a device for your young person if they're ready to or trying using tampons. It's also something where they could sequence it, and it could be a bit of an activity around the ordering. Just a reminder that tampons are optional and they're only one of many products, as we've mentioned earlier. So if your young person isn't comfortable using them, that's okay. If they're curious and ready and interested, then this visual schedule could be really helpful. I also like that the visual schedule shows external and internal, so their understanding grows, and that's further shown on this slide here as well. All right, I'll hand back to Dr. Soraya now to discuss period pain and its management.
Great, thank you, Emily. So, put simply, so what is normal period pain? I think if we're thinking about what's in the realm of normal period pain, it's pain that allows a young person to continue with school, with activities, with their daily life. If pain is so severe that someone's missing school, if they're staying in bed, if they're withdrawing, if they're unable to function normally, that's a good reason to see a GP for further support and to look into it further. In terms of why we have period pain, it happens because the body releases a hormone called prostaglandins, and they cause the uterus to contract. And these contractions are really important to help that lining shed. Period pain is usually felt in the lower abdomen or the pelvis, and it can go to the back. It can also go to the thighs. And for most people, the discomfort will last 1 or 2 days. It might start just before the onset of your period. And there are several simple things that you can do to help with the pain. So the easiest would be heat packs or a warm bath. And then there are medications such as paracetamol or ibuprofen, which is also known as Nurofen, which can be taken together if needed, and the generic and the brand versions work the same way. So it's often a common pitfall for young people to want to manage the pain without pain relief or try and have it very sparingly. But interestingly, ibuprofen or Nurofen actually reduces those prostaglandin hormones. So by reducing that, it can reduce the pain that's felt and also the amount of bleeding that you experience. So it is a good idea to take pain relief early on and to kind of continue it on the days that you are having pain. And we'll talk about kind of more with other red flags, which we look out for if you're using quite a bit of pain relief. Something else to know is that regular exercise can also be helpful in regulating the hormone cascade. throughout, which occurs each month. So it's just another reason, to stay active when you've got your period. So the next slide, if that's okay, PMS, here we go. So in the days leading up to a period, some people might notice a group of symptoms known as premenstrual syndrome or PMS. So not everyone experiences these symptoms, but if they do, there can be things like bloating or breast tenderness. You can get changes to your mood. You can get changes to your appetite or headaches. And for most people, these symptoms are mild and temporary, and they settle once the period begins. There is quite a obvious pattern to it. So, if you're experiencing these symptoms a week after your period, it's probably not PMS. And one of the best ways to help figure this out is to track symptoms alongside the menstrual cycle. So you can do this using a simple calendar. So you can either print one out and pop it on the fridge, and then you can make note each day of the symptoms that you're experiencing. Or there are lots of apps which are free that you can download and help track for young people and see what patterns and help understand how their body's changing during the cycle. So when to see a GP or a clinician. So if period pain is not improving, even though you're taking regular paracetamol and ibuprofen, or if it's escalating or lasting longer than kind of 3 to 4, 5, 6, 7 days, if it's severe enough, like I said, that it's affecting your school or daily activities, or you're not able to go about with, usual things outside of school. Another reason would be if you've had a regular period and then all of a sudden it becomes very irregular, or if your bleeding is very heavy. And it can be really hard to know what's heavy and what's painful because you're comparing to yourself. But what we would say is quite heavy is if you are using more than 6 or 7 or 8 pads a day, if you're leaking through pads, or you're needing to use both pads and tampons, or finding that you're leaking through overnight, these would all be signs that you have potentially heavy bleeding. And why we care about that is because over time that can lead to low iron levels, or what doctors call iron deficiency. And if it's left long enough, that can lead to anemia. So iron is the building block for our red blood cells. So it's important that we're getting enough from our diet, but also that we're monitoring we're not losing too much from our periods. So some of the symptoms of iron deficiency can be feeling tired, difficulty concentrating, poor sleep. So it can be quite non-specific, and I feel like most people feel like this day to day, but it is important to diagnose and treat it if it's present, and it is entirely treatable. So if you have any concerns, just see your GP. The other thing to see your health professional with is if you just need support. So sometimes with period management, you might not know where to start. And there can be more that's done other than just education, particularly if there's behavioural concerns, or if you're having difficulties using a pad or period underwear, or with PMS if you're struggling with aggression in a young person. So that's another point where you can come in and we can help out. So the next slide, thanks, Emily. So this is just an example of a calendar that can be printed out. It's freely available if you Google Jean Hales. By doing this, like I said, it lists the symptoms on the left-hand side, and then it has each day of the month, and then you can see at what point in your cycle are you experiencing these symptoms. Next slide, thanks. So when a young person comes to visit a doctor about periods, the goal is to understand what their main concerns are. So the doctor might ask questions about when your period first started, how regular your cycles are, and that's when you can show them your calendar or your app if you have one. They might ask about your pain levels and how you're managing with your pain and the bleeding pattern. They might also ask about mood changes or other symptoms, and about hygiene and menstrual products. So sometimes we also will discuss other related topics like contraception and relationships and sexual health, because once someone begins menstruating, they are biologically capable of becoming pregnant. So when you go to see the doctor, usually you'll come in with a support person, which might be your parent. And we try to flag early at the start of that talk that it would be great to speak to both of you, but also just to speak to the young person alone. And that's because it gives the young person a chance to ask questions that they might otherwise be a bit shy of asking in front of their support person. So we also do try and assess their capacity to consent, and this might be for treatment or for anything related to their healthcare. And we also will try and assess risks associated. So keep in mind that to do this well, it might need multiple consults. So you might need to indicate beforehand that you'd like to have a long appointment for your booking, or it might just be that you have multiple chats with the doctor about the same topic. Thank you. So doctors often speak, with young people about contraception, and it's important that we involve young people as much as we can in the decision-making process because, like you will see shortly, there are a lot of different options, and it really depends on the person's individual circumstances, their understanding, as well as their preference. Next slide, please. So this slide kind of talks about, so when we are deciding to use hormonal contraceptions, many young people will just be able to manage their periods with education, support, and the practical strategies that we're talking to you today. But in some instances, hormonal contraception can be really helpful. So most people will know contraception as something that prevents pregnancy, but that's not all that they can be used for. So a young person might be having difficulties with acne, or they might want help with regulating their period, or they might want to skip their period, which is when you can have medication to delay or avoid having your period. And they might also just want help with painful periods or heavy periods. And so we do have hormonal medication that can help treat all of these things. I will say here that it is a myth that if you're not having a period because you're on hormonal contraception, that period is staying within the body. That's not the case. A lot of these medications are basically preventing the lining of the womb from thickening. So it's basically just never getting thick. And as a result, you're not shedding barely anything. Thank you. So these are some of the options that we have available. You may have heard of the combined oral contraceptive pill, which is a pill that you take roughly at the same time every day. There's also a vaginal ring, which sits in the vagina and releases hormones. And there's the progesterone-only pill, or what we call the mini pill, which basically doesn't have the estrogen part for those who can't have it. There's the depot injection, which is given every 3 months, and the hormonal IUD, which is placed inside the uterus. There's also the contraceptive implant, which is a small rod that's placed under the skin of the arm. And each option has its advantages and disadvantages, or I should say side effects. So the best choice depends, like I said, on lots of different factors. I will say it's important to remember that these options are reversible. So if one option doesn't suit someone, we can try a few different things. So I'll hand over to you, Emily.
Thanks so much. It was so valuable hearing all the different kind of expectations for when people are connecting with health professionals. And I think one thing that keeps standing out across what we're saying is how personalized this is for you and your young person, and your right to receive that information. I just wanted to add to what Dr. Soraya was saying, which is that at Family Planning, which Planet Puberty is associated with, Family Planning Australia, we do have longer appointment times as well. And that might be something that if you're organising this appointment for your young person, whether you're coming to us or someone else, you might want to request. But coming back after all that really important information, a really important principle at Planet Puberty is just kind of reminding everyone that self-care is still really important. So hopefully this webinar has given you some strategies, but also if you're feeling, that there's quite a few steps to come, just valuing that self-care, whether that's some alone time, asking for what you need, setting some boundaries. It's really important to, look after yourself. It's not an indulgent and it doesn't always needs to be a big thing or a spa treatment, but it's really important to find those moments and recharge yourself. I'm now going to jump into some resources on our website that can support with continuing to dive into periods and menstruation. So for those of you that haven't accessed it before, this is the homepage of our website, and you can search for periods and it will give you information yourself around what's going on, and then it will also highlight some of our different resources. Amongst our resources, we have a lot of really fantastic videos, and I'm really passionate and excited about the videos we have about periods. So we've got some around, did your first period help make you feel different? What's positive about your first period? What do you wish you'd known? We also have a YouTube page. Our YouTube page, as I said, has heaps of videos on there. You can follow our account on Facebook. This is what it looks like. And again, it's got some really great videos. Some are aimed at parents and carers. Some show parents and carers experiences. Some show people with a disabilities experience. And some are targeted as well to watch with your young person. So one of the videos on the screen is an introduction to period products for children with autism and intellectual disability. And it does a really good job at unpacking kind of visually what to expect, so that isn't a surprise for your young person. Some other really great resources are our podcasts. So we have 2 podcasts on periods and going with the flow. We have another guest speaker on that podcast, and to those of you that know her, Dr. Melissa Kang is also known as Dolly Doctor. So she has worked in the space for a really long time, speaking to young people and explaining to them these changes and strategies that can make them feel confident and prepared and comfortable. We also, as I've mentioned, have some great games on our site, and these can be played by young people. And the one I wanted to highlight on the site that I thought was really relevant to periods was our identifying feelings. So in the entry level, level 1 of this game, a young person will look at photos and decide how someone is feeling. And then the next level is they can put their own photos in, or you can put photos in as well and have them starting to identify those feelings. So if new feelings are emerging with periods, that's something then that you could develop as like an offline game to help explore those new feelings. And that as well could help with identifying and tracking with a menstrual calendar what's going on for a young person's body, both in terms of physical symptoms and some of those emotional symptoms with feelings. As I've mentioned, Planet Puberty is associated with Family Planning Australia, and I just wanted to highlight some of our locations, which are in New South Wales, where our staff are trained and we have those longer appointments available. I know we have a lot of people joining us from different states as well. So on the next page, I've outlined some useful contacts for across Australia. So whilst Family Planning Australia is in New South Wales, there are different providers in different states that provide similar services.